Dr. Andrea Mcnab. I'm one of the plastic surgeons with Beverly Hills Physicians, and I've been with the group for about 2 years. I'm primarily in the Encino, Thousand Oaks, and Oxnard locations if you ever want to come in for a free consult.
Hi, I'm Dr. Misra. I'm a board-certified general surgeon, fellowship-trained or specialty-trained in weight loss surgery, or bariatric surgery. I've been with Beverly Hills Physicians for about 10 years now, and you can find me at multiple locations, the Beverly Hills, Encino, Thousand Oaks, Rancho Cucamonga, and Pasadena offices. I'm available for a free consultation and would love to meet with you.
Hi, my name is Dr. Anita Patel, and I'm a board-certified plastic surgeon. I'm currently in my 12th year of private practice, and I'm currently seeing patients in Thousand Oaks with Beverly Hills Physicians.
I think it is absolutely an advantage in the plastic surgery field, especially because the majority of our patients are women. Of course, we do operate on men as well, but we definitely see females the most. And I think it helps because we know what they're feeling, what they're thinking, and we understand what society is telling people and the pressures from their peers. So I think that's something special that a female plastic surgeon has that we can use to relate to our patients.
I would say yes. I do think that being a female in bariatrics is an advantage. And part of the reason why is, although obesity affects both males and females, the majority of the patient population that are coming for help are females. It's probably 70% of the people that are coming in for consultation to come and have surgery are females. And I think obesity is such a personal issue. It actually can be a very emotional issue. And I think just that ability to relate and really make them feel comfortable is a very positive thing. And so I've been told by my patients.
Yes, I do think being a woman in plastic surgery is an advantage, mainly because I'd say 90% of my patients are women, and they're coming in for something they're really self-conscious about, right? So when they come in, they want to be somewhere where they don't feel like there's judgment. Feedback I've gotten from patients is they were already embarrassed about this problem, and they've seen a lot of times a male plastic surgeon, and it might have been an innocent comment or something that they thought would break the ice, and as if a little joke, but it hits them the wrong way, and it instead makes them feel even more self-conscious. So I'm not going to say that all across the board that's harder to go to men, because I think they can also empathize, but it's different when you see a woman and she can relate to what you're saying.
Yes, that's not really a good way to start the answer, but one of the things that's amazing about today's times is that all of this is changing. Either the first year or a couple years ago was the first time that there were more females than males enrolled in medical schools across the country. I think traditionally surgery in general had been a male specialty, but I think we're getting away from that. We're making the environment more conducive to having families and more conducive to women. So although that may have been true in the past, it is changing every day.
I'm actually from the time a long time ago. So I started medical school in like 1995. I started my general surgery residency in 1999. So in that time, there were very few females in surgery. And I believe that it was just the traditional roles that males were sort of considered to be able to dedicate their entire lives to their career. And surgery was such a amazing field, but you really had to almost be obsessed with it to be good at it. And I think that was sort of the thought process. I think I am obsessed with it, but I think time management and organization makes a difference as well. And I think if you're passionate about something, I think you can be amazing at what you do if you love the job that you're doing. So although that was traditionally the way things were, that there were more males, fortunately it's been almost 30 years and things have improved significantly. There is a lot more females applying to medical school and going into surgery. And I think having some of the regulations set in place for hours of work has made a difference, which has changed from when I first started, but also just an understanding that you can control a lot of what you do, and having good mentors. So I go out of my way. I love teaching, I love giving back. So although most of my mentors were males, they were very supportive and were able to see past me as just a female, but see the love I had for the specialty, and helped me grow into the surgeon I am today. And I'm always thankful to that and to them, and so I try and give back. So I think having female role models out there for medical students, residents, and fellows. We're able to kind of change that so there are more females, because I think females are amazing and they're amazing surgeons, and I am just trying to do my part to give back.
You know, I started my training in the early 2000s, so 2001, and it was a lot less women than you see coming through now. And in my plastic surgery class, I was the only woman. So I do think all of that is changing, but the biggest reason I think is work-life balance. So I think most people know these are going to be your childbearing years, so maybe to choose something with less intensity and less hours, because surgery training, back when I did it, we didn't have the 80-hour per week rule. So you could be in the hospital for 130 hours sometimes, and you're going home deciding, do I want to shower or eat, or shower or sleep, you know? So it was, you know, it's very intense. So if you also have kids at the same time, it's a lot to balance. And you can do it, you know, people have done it and they continue to do it, but it's hard.
One of the most difficult things I think about being a surgeon and being a female is being taken seriously. I think a lot of times people have that image in their head of a surgeon as an older, gray-haired man, and times are changing. That's not always true anymore. And so I think whether it's conscious or not, people have that idea in the back of their head, but of course female surgeons are just as capable and just as talented. We just look a little bit different.
So I think one of the biggest challenges that I face now is really time management. So I have a family, I have a 5-year-old son who is amazing and a lot of energy. It takes a lot of time, but I love what I do and I would never give that up. It's part of me, it's part of who I am. And so I think a lot of it is just time management, to be able to give 110% to my patients. They have my cell phone number. I want them to feel excited about what they're going through and comfortable, and I want to give as much as I can to them, which I do, but also make time for my family, my husband and my son. So it's really just time management.
I'd say there are two main challenges as a woman. I think one, on face value, you're often underestimated because there's an image people think a plastic surgeon should be like and even act like. And if you don't fit that, I think at the beginning that could be at your disadvantage, but in the end I think it's a huge advantage because not everyone wants that stereotypical surgeon. So I think that's an advantage. But the biggest disadvantage is probably, I know we've all said it, but work-life balance, because, you know, say if you have kids, it's hard to get, you know, the home life and the work life like equally as perfect as you want it. But if you don't have kids, it's really easy to just only focus on work, and then years go by and all of a sudden you realize, oh wow, like I haven't done that yet. So I think that's probably the biggest challenge.
I think the best advice for a woman that wants to be a plastic surgeon is do it. Do whatever you want to do. Whatever you think is going to make you happy, whatever you think is right for you, where you can channel your passions into your work and interact with people. If that's what you want to do, then absolutely do it. Don't let anyone tell you you can't.
Oh, I think it's fantastic. I feel like I am blessed and I have the best job in the world. I'm able to give something to patients that they've been struggling to achieve their entire lives. There are so many patients who have lost weight over and over and over, and it always comes back. And now I'm able to give them something that completely changes their lives, making them healthier and happier and living longer. And so if there's any females who are interested in doing something like surgery, just make sure it's something that you love. If you love it, you're going to do amazing at it, and time management is a big thing, but you know, I think being organized is something that is doable, and it's just, if you love it, do it. It is an amazing career.
I think for any woman who's considering a career in plastic surgery, first look at why you really want to do it, because I think sometimes people see only the glamorous side and think that's what it's all about, but there's actually a lot more to it, and you're going to go through a lot to get to that point. But if it's something you want to do, absolutely go for it, because I think I love it, and I don't at no point do I regret having chosen it, but I think you have to really love it and want to do it for the right reasons. Actually, I got some advice when I was in medical school, and it was, if you like any other specialty as much, do that, because it'll be an easier route. But when I really thought about it, there wasn't anything else that compared to me, so I ended up choosing what I loved.